Hello, I'm Dr. Fareen Karachiwala, Associate Medical Officer of Health for York Region. Last Thursday, the province-wide stay-at-home order came into effect. This order means that everyone is to remain home and only leave for essential purposes, like going to a grocery store or pharmacy, going to a vaccine appointment to get your COVID-19 vaccine, accessing healthcare services, exercising outdoors, and doing essential work that cannot be done from home. As students begin their April break, it's important we do not let our guards down and risk getting ourselves or others sick. Please do follow the stay-at-home order and do not gather indoors with anyone outside of your household, and do not travel for non-essential reasons to other areas outside of York Region. The simple actions of every one person can and will impact the community at large. We're at a critical point in the response. We continue to review our data, and discussions are active and ongoing with our school board partners, the Ministry of Health, and the Ministry of Education related to the possibility of moving to virtual learning for some time following the April break. On the vaccine front, the Government of Ontario has announced an official move to Phase 2 of the provincial COVID-19 vaccine distribution plan. This phase is focused on age and at-risk populations, including people in hotspot communities and those with certain health conditions. It also includes essential frontline workers who cannot work from home. Eligible groups will be rolled out over time based on provincial guidance and will become eligible to book appointments at different times in priority sequence, as we also account for vaccine supply. The people eligible in Phase 2 are a large and diverse group, and so the demand we will see in coming weeks is unfortunately expected to exceed our current vaccine supply. So, for example, over the next 6 weeks, we have the capacity to administer 10,000 doses per day for a total of 390,000 doses. However, the expected vaccine supply will leave a notable gap of more than 165,000 doses. So over the coming weeks, please continue to remain patient with us. We are doing all we can to plan, make provisions, and get through the priority groups based on what we have available to us. We have already steadily progressed through the priority groups identified in Phase 1 and have, as you know, already begun vaccinating some groups in Phase 2 ahead of the provincial schedule. In fact, to date, York Region has administered over 250,000 doses, and nearly 1 in 5 York Region residents have actually had their first dose. This is pretty remarkable progress to date, and we are very grateful for it. So what's coming up this week? Effective Tuesday, April 13th, starting at 8:30 a.m., more eligible York Region residents can book an appointment for their COVID-19 vaccine by visiting york.ca/COVID-19 vaccine. Eligibility is being opened to individuals and one of their caregivers who fall under the highest and high-risk health conditions as identified in Ontario's COVID-19 vaccination plan. Eligibility is also being open to special education staff who work in York Region and provide direct supports to students with complex special needs. When it comes to the hot zones, the province has identified 114 high-priority communities across Ontario based on COVID-19 rates, hospitalizations, and deaths, of which 13 are in York Region. When providing vaccines to the high-priority communities or hotspots, we have focused on an age range that has higher risk of hospitalization and severity from COVID-19. But we remain prepared and ready to ramp up if we do get increased vaccine supply. While the province has announced that mobile teams are being organized to administer vaccines in high-risk congregate settings, residential buildings, faith-based locations, and locations occupied by large employers in hotspot neighborhoods to people 18 or older, York Region Public Health's immunization strategy is restricted to what we can achieve with our limited vaccine supply. In fact, due to our current shortage in vaccine supply, we only have a limited number of appointments available this week and have been forced to close 2 of our public health-led clinics. We are looking ahead, though, to offer vaccines soon for individuals aged 60 plus, as well as additional educational staff, essential workers, and residents in other remaining hotspot communities identified by the province. And do remember, those who are aged 55 and older are able to book an appointment to be vaccinated at a number of pharmacies across the region. We will continue to follow provincial guidance as well as our local data to balance the competing needs of the community against the limited vaccine supply currently available to us. More information can be found by visiting york.ca/COVID-19 vaccine. Finally, and as always, thank you for your compassion and patience. We know with the recent stay-at-home order and rise in cases that people are feeling a range of emotions, including worry, and we are working as hard as we can with our resources and supply to move fast. We continue to ask you to please do your part and follow the stay-at-home order. We cannot afford to lose ground now. And please remain kind and compassionate to one another, to our staff, and to yourselves.